Hi, my name is Benedikt Christ. Welcome to the presentation of our project entitled Tracing People Living with HIV who are lost to follow-up at ART programs in Southern Africa, a sampling-based study in 6 countries. This is a regional project that we conducted at ART programs in the IDEA Southern Africa region. A brief background. People living with HIV can get lost during care because of a variety of reasons. But unknown vital and care status among those who are considered to be lost to follow-up, abbreviated LTFU, can bias program-level estimates like mortality and retention in care, and active physical tracing is one mean to ascertain the vital and care status of all those that are still in care. Methods. We sampled approximately 500 people living with HIV at 8 ART programs with a target sample size of 4,000. We established a disproportionate stratified random sampling among all those that were classified to be LTFU from January 2014 to June 2017. Depending on the setting and country policies, the definition for LTFU was 60 days or 90 days after a missed appointment at a health facility. Thus, in this study, we sampled a mix of very old cases lying several years back and some younger cases of people living with HIV that got lost during care. Moreover, strata included sex, age, and time on ART. Before active tracing started, we checked the medical records of all people living with HIV who were sampled to confirm the lost to follow-up status and to obtain contact information. If the participants were confirmed to be LTFU, we initiated tracing, which consists of up to 3 phone call attempts, up to 3 home visit attempts, and another attempt if needed. Results. As shown in this flowchart, 19,722 people living with HIV were eligible for this study. 3,256 were sampled. Among all sampled, we found through examining their medical records 12% as erroneously classified, whereas 11% were found to be alive, and almost all in care, for instance, at another health facility. 1% had died. Of about 17% of those sampled, we did not get any information from the medical records, as those weren't locatable or no contact information were indicated on the respective records. We finally traced 2,294 people living with HIV, which makes about 71% of all sampled. However, this differed from 38% to 99% across programs. The second part of the results shows the vital and care outcomes obtained through tracing, overall, and by ART program. We here present percentages of different categories of vital and care outcomes. Overall, 57% were found to be alive, all bars here from yellowish to orangish. With 34% found to be alive and in care, most of them were silent/unofficial transfers from one health facility to another one. 19% found to be out of care, and of 4%, the informants were not able to provide a care status update. 11% have died, in blue here, and for the remaining 32%, we were not able to find any informant and they remained true lost to follow-up, in gray. As you can easily see on this figure, by comparing the colored bars, there are substantial differences across ART programs. Overall, 1/3 of people living with HIV who were classified as lost are alive and in care. About 10% died. 40% remained lost due to unreliable records, missing information, or the inability to find the participant in person or an informant. We had a high heterogeneity in terms of outcomes. It is not only about the medical chart, it's also about how patient data is managed and checked. Thus, electronic national patient management systems could help. This should include standardized tracing procedures and methods and systems that allow a better exchange of patient information. Targeting people at high risk of death or of disengagement from care could help to avoid high numbers of people becoming LTFU depending on the local context and its specific needs. With this last slide, I would like to thank all the study participants, all the tracers, data managers, and others working at the ART programs for making this study possible. I also want to thank the NIH and the SNSF for their funding, and last but not least, all colleagues from IDEA Southern Africa and co-authors for their valuable inputs during the whole process. Thank you for listening.